I'd like to thank everyone for coming to this event today. It's been a long process to bring this event to fruition. My name is Linda Piper. I am a student in the master's program in the School of Social Work and president of the School of Social Work Student Organization. And I am thrilled to be here today with so many of my classmates as well as our honored panelists today. I'd like to introduce, left to right, John Bradley from Preble Street, Karen O'Rourke from the School of Public Health, and Jenna Cruitt from the School of Social Work. And we will also be joined later in the program by Mayor Brennan. He had an event that was bringing him to 12 o'clock, so he was going to be arriving late. What I'd like to do at this point is to let our panelists further introduce themselves and to talk a little bit about their current jobs and what brought them to those jobs and the role of policy in those jobs. So if you can give a warm round of applause to our honored guests. It doesn't matter to me.
I don't mind, I guess. Am I supposed to? This is working, yeah, I can tell. So, my name is John Bradley. I'm the Associate Director at Preble Street. Well, I'm not sure how far back I can go to what brought me here, but when I got my MSW, it was in really more clinical practice, although I wouldn't say clinical at the time. It was really had mostly direct services, but I always saw the connection to bigger picture things and certainly saw the need for advocacy as part of my repertoire. Maybe because I came out of the 60s and it was, I never desired to sit in an office and learned pretty quickly that I liked being out in the field. For me, the field started at the Port Authority bus station in New York, so it was a pretty intense field, working on outreach and connecting with all kinds of people. But at Preble Street, it's safe to say that advocacy, big picture, working on those issues that would make a difference is part of who we are. It's in our mission to advocate for changes. And so we do that as a matter of course as an organization. We have an advocacy program. When I think about what that looks like for us at Preble Street, it can go all over the place in the sense that so much of what happens at the federal government, at the state government, and even the local government affects the people we serve, people in poverty, people who are hungry, and certainly people who are homeless. So it's critical to be part of the conversation when those policies are being enacted or being talked about. So we have a large group of consumers who work with us, the Homeless Voices for Justice, and I spend a lot of time working on policy issues at the city, trying to create better housing alternatives. When Mayor Brennan comes, I guess he can talk about a lot of the different things that are happening in our field that he's been part of. Certainly, we're very involved in the conversations in the, I guess that's a polite way to put what's going on between the city and the state, but we're up in Augusta pretty much every day now at the legislative hearings because what happens there really matters. If we change general assistance in a way that cuts lots of people off, that's more people who'll be struggling with housing, more people who'll be struggling just to get by, and probably more people in our shelters. And we're already overwhelmed. So we are looking to try to change local policy on shelters, but we've got to pay attention to the state policies and even to the federal policies. A lot of what I do is look for possible grants and funding, and to do that right in any community also means working with others. I just came from a large meeting at the U.S. Attorney's Office on human trafficking because that's an issue that we've become very involved in. And it takes law enforcement, health, mental health, certainly addictions, and people are out there working, doing case management to tackle an issue like that in a way that gets people healthy. It also takes looking at the laws that target people who are trafficked versus people who traffic them and things like that. So I don't know how much, as I said, I could go on forever about the number of different directions that we end up getting pulled. In fact, today I feel like I'm pulled in so many directions that I can't keep up. The last thing I'll just say is, for those of you in social work and health, we have a big problem in our field with aging. Homeless people, especially those that are chronically homeless, are aging just like the rest of us. And their lives are often shorter and filled with many issues. And so what we're seeing in shelters increasingly and in our programs are people whose mental illness and or substance abuse, lack of housing, and now chronic medical issues, health issues like diabetes, COPD, people in walkers, people with oxygen. It's a sad situation to see older folks with those disabilities in shelters or in programs that aren't geared for them. So we're doing a lot of work to try to better integrate with the health homes, and I know we've been talking at points with Mercy and a lot of conversations with Maine Medical Center about how can we provide better care for people who have those multiple needs. It takes a really comprehensive view to really help people, and it does that at all levels, from the planning to the thinking about the big picture or to policy issues. So that's my introduction.
Thank you. Karen?
I'm Karen O'Rourke, and as Linda said, I'm over at the School of Community and Population Health. I have a number of roles there that I've played over the 5 years I've been at UNE. I'm currently the director of the Maine AHEC network, and also work on some obesity policy stuff, and I see the mayor has just arrived. Welcome. So just to give you a background, about 30 years ago, I was only 10 when I started public health school. I got my training in public health, and it was very traditional, health education. We did talk about community organizing, but I don't think the word policy change or advocacy actually really came up then. So it was really not really part of what I was trained to do. And so the way I got involved in it was my second job with the American Cancer Society on the East Coast here. They wanted somebody, in addition to 20 other things they wanted somebody to do, was to take on this new priority area they had around advocacy. So, okay, I said, fine, that's something I'll learn about, and I took it on, and actually I've never looked back. I'm a generalist in public health. I cover many, many topic areas over my 30-year career in public health, which I'll talk a little bit about that, but always policy has been the core to everything that I've ever done in public health, and continues to be the core of everything that I do in public health. And there's three really major reasons for that. The first is that so much about public health is about culture change. How do you change the culture so that people don't think that smoking's a great thing to do? Or how do you change the culture to get people to think about exercise or to go see a doctor or all of those kinds of things? And policy is really the most effective way to do that. The second reason is really it's a social justice issue, is that not everybody's from a community or a family or a home or a school that does all the things that they need to do to take care of them. And policy sometimes can be the equalizer, can make sure that people have access to the kinds of things that they really need. So it's really, policy is an important piece of social justice. And finally, nobody's ever going to give public health a lot of money, so it's a cost-effective way. We're never going to reach every child or every adult and with the kinds of messages that we need. So it's very cost-effective public health policy. I thought maybe I'd give you a few examples over my career of ways that I've incorporated policy into the work that I do. Like with the Cancer Society, we might have a large focus on breast cancer we did one year. And so, the public education people thought about what are the messages that we need to get out to women and about breast cancer, early detection. What are the messages, professional education, what are the messages that we need to give out to, doctors and nurses about early detection? And then finally we thought about, well, what are the policy issues that are preventing people from doing the kinds of things and getting the kinds of outcomes that we're interested in? And so we said, well, at that point in time, actually mammograms weren't covered for insurance, so we went to the State House and we made sure that mammograms were part of that policy. We did 1 year a skin cancer campaign. Same thing. It's okay, what's the public message, what's the professional education message, and what's the policy issue that's affecting what we want people to do? And we realized that tanning booths were not regulated in any way. So we went back to the legislature and we got them to do some regulation of that, so people at least had the information and kids weren't just going and going crazy on the tanning booths. Oral health, when I was in the city of Portland, it was like so disheartening to see 5 and 6 and 7-year-olds with totally bombed out teeth. Well, at that time, Portland and the surrounding communities weren't fluoridated. So although there's many policy issues related to oral health, one of the things that we did is say, hey, we can keep giving these kids these sealants, but half their teeth you can't even put sealants on because they're so bombed out. So we really need to go and give those kids at least a fighting chance by fluoridating community water. Lung cancer, cardiovascular disease, tobacco, of course, is a huge issue. And so how do we make sure that people have access to clean air? Well, you have to go and pass policies, and the mayor's been around a lot of these. When you make clean indoor air, clean restaurants that don't allow smoking, schools that don't allow smoking, and all of those kinds of policies. And now, the latest issue that I've been working on now for the last 10 or 12 years around childhood obesity. How can we tell kids, you need to eat healthy? You walk into a school that's full of junk food and soda and all the kinds of things that we know are contributors to obesity. So you go back and you work with the school department, the legislature, and to pass policies that make a difference. So those are just some examples of how I incorporate policy every day into the work that I do.
Thank you, Karen. Jenna?
Hey everyone, my name is Jenna Cruitt. I just graduated from the MSW program here at UNE last May, and I now work as an administrator, and I am also organizing the campaign school and political advocacy training that's going to be happening here in this room April 24th and 25th, and I'll be talking more about that later. But my background, I decided to get into social work because I was in the wilderness therapy field, and so I was coming into it as a clinician. And then I quickly learned that social work also entails program development. So I decided to get into that because this wilderness therapy program that I was working for actually got shut down from the state of North Carolina. Even though we had data showing how effective it was, it changed lives and it saved money. So I wanted to work on the program side to get it up and running so that it was actually sustainable. So that's where I was my first year of my MSW program, and I was at my internship at the Muskie School of Public Service, where I just so happened to get involved in creating the language for a bill and following the bill through to when it was testified and it actually passed. So prior to that experience, I was ignorant and jaded about the political process. I had no faith in the system whatsoever, and I learned that bills do happen and they do pass and they do change lives. So that was just a wake-up call of that was my newfound passion, and on top of that, my passion was to educate other people who might be jaded from the political system and just educate them. So that's where the campaign school came in. I attended the campaign school at UConn, which they've been hosting for almost 20 years. It's the only one in the country. And walking into that workshop, I had no interest in running for political office whatsoever. And within 5 minutes of hearing this extraordinary woman speak, Kate Coyne-McCoy, she will be here on April 24th, I did a complete 180 of there's all these people in office that shouldn't necessarily be there. They don't make good choices, and they don't necessarily care about the people that elected them. So why the hell wouldn't I run? Because I do care about the people, and I do have the skills and the passion to create change. So this campaign school, the first day, it's about why you, as a practitioner, you meet with these clients every day, you know the issues, you know how to fix them, why you should run and how you should run. And the second day will be about, okay, so running isn't for you, that's fine, not everyone can do it, but there's other ways you can get involved. Anything from testifying on a bill that helps your clients to being a campaign manager, communications director, et cetera.
Thank you. And finally, Mayor Brennan, who has arrived, and we're so happy to have you with us today. Thank you.
And what exactly at this point we're just kind of talking
General
about?
introductions and how you became interested in policy and how it brought you. You are in a unique position. Mayor Brennan is not only the mayor of Portland, but is also a graduate of the UNE School of Social Work. So I thought it was an interesting combination.
And are all of you social workers, or none of you are social workers?
Some.
Half.
Some.
Always in the minority over to the side. And the rest are healthcare. Okay, great. Well, I'll just tell you quickly one experience. I went to the Muskie School before I came to UNE for social work, and I got a master's in public policy. And for those of you that the Muskie School is very quantitative in its approach to policy analysis and looking at policy issues. And the first 6 months when I came to UNE, I really struggled because every time I was in class, I'd say, well, I think this, and I think that, and I'd cite some research. And finally, the professors and the other students said, we don't really care what you think, how do you feel? So the difference between going to policy school in terms of the focus on quantitative analysis and policy analysis, and then coming to UNE and becoming a social worker, the focus was how you feel about things. And I always think about the fact that when we talk about policy, sometimes, not often, but sometimes we get good policy when we're able to combine what we think with what we feel. And when we're able to combine some quantitative and analytical data with the passion that we feel about something, that oftentimes we can move in the right direction in terms of policy. And I'll just tell you two quick stories. I'm sorry, I got a little nervous when you talked about being jaded. I spent 13 years in the legislature as one of those elected officials that and I actually shouldn't say this because, well, Frank can't do anything to me now because I'm not a student. But I first got elected to the legislature in 1992, and I started as a full-time MSW student in 1992. So I was going to school full-time at the same time that I was in the legislature full-time, and I served on the Health and Human Services Committee. And you can imagine what an exciting experience it was to simultaneously being school, studying clinical work as well as policy, but also being in the legislature at the same time, serving on the Health and Human Services Committee. So as those of you as social workers, one of the struggles within the program is you have to do a 20-hour-a-week field placement. And being in the legislature and trying to find 20 hours a week to do the field placement was a challenge for me. So I read the student handbook of what was required of first-year social work students and that field placement, and they said one of it was group work. So I went to my faculty advisor and I said, look, I'm in the legislature, that's group work. And every day when I'm dealing with other legislators, that's therapeutic and group work. So they gave me 15 hours of my field placement for being in the legislature doing group work. So I felt I was able to combine the two. But just two kind of quick stories again. In 2004, I had the opportunity to go to the Kennedy School at Harvard. And it was a 3-week residential program that they had for elected officials, public officials, and all kinds of other people. It was basically people that could pay $10,000 to go there and spend 3 weeks. And there were people from 25 different states, 4 different countries. I was the only social worker in the group of 55. And I think there were 3 of us that were in the state senate at that time, and there were a lot of people that worked in state government. And the first day, first class, a man named Dan Fenn, he was 82 years old, came in and taught the class. And he had worked with John F. Kennedy in the Kennedy White House and had been the first executive director of the Kennedy Library in Boston. And he taught a whole course about First Amendment rights and freedom of speech, and it was very good, and we all thought it was quite interesting. And then he just we didn't see him for 3 weeks. And he'd show up every now and then at dinners or just kind of walk around, wander around. And then the last day, the last class, when we were all getting ready, the last hour to leave, he came back into the class and he said, I just want you to know that you have just gotten the best that Harvard has to offer you in management, leadership skills, logic, models, all the various techniques that you need to manage public health, social work, whatever you're doing. And let me tell you, they all don't matter. And of course, he didn't tell us that 3 weeks before we paid our $10,000 to go listen to everything. And he said the most important thing in public policy, the most important thing in the political process is relationships. And he said your ability to form relationships and maintain relationships with people will do more to influence public policy and advance what you'd like to advance than all the techniques that you're going to learn about the political process or about quadratic equations and policy analysis. And obviously, as a social worker, and at that time I was in the state senate, what he had to say really resonated with me because so much of what happens in terms of influencing policy and what happens with policy is based on personal relationships. And I'll now totally go into a non sequitur on that point and say on Monday I met with the governor, and where he and I are both working on our relationship with each other and trying to build one. But I was telling him the story about when second term I was in the legislature and I served on the education committee. And I sat next to a man called Rod McElroy, and he was a Republican state legislator from Unity, Maine. And he was a former school superintendent. He was in his late 60s, and probably at that time I was in my early 40s. And almost 90% of the items that we voted on in the education committee, we agreed on and voted the same way. And that 10% wasn't a big disagreement. It was usually more tactical or strategic than it was philosophical. But 90% of the time, I would turn to him, he'd turn to me, and we'd support what was being proposed. Then we would go out to the floor of the House, and 90% of the time, we would vote differently than each other on issues related to the death penalty or reproductive rights or civil rights or the environment. 90% of the time, we would be in different places. And what that relationship and what that taught me, he and I were very close and we still stay in touch. Again, it's important, the relationship and the importance that every time we start talking about politics, we start talking about policy, we have to understand that it's about people. And all the prejudices, all the good things, all the other emotional things about people come into that process. And that's not always rational, it's not always objective, it's not always fair, and it's not always just. But in that arena, it's very, very important not to become too self-righteous and too judgmental, because every time I used to become self-righteous and every time I'd become judgmental, I would then come across somebody who was entirely different philosophically from me that would find common ground and would find agreement. And you really make a lot of progress moving forward when you can focus on that common ground and focus on that agreement rather than the ideological, philosophical, or differences that you might end up having. And lastly, what I'll say in terms of my involvement and my interest in public policy, I was very fortunate when I was 25 years old. I worked for Ralph Nader for 2 years. And at that time, that was the major goal of my life, was to be able to do public interest work working with Ralph Nader. And I was hired to work on a project for him and then spent 2 years working for him. And one day I was down in his office in Washington, and he was meeting with a young man who had just graduated from Harvard Law School. And Ralph was saying to him, I really want you to come to work for me here in Washington. And the young man, he said, well, you know, how much will you pay me? And Nader said, well, I'll pay you my top dollar to be here in Washington. And at that time, I think it was like $12,000 was the top dollar. And this young Harvard Law School graduate turned to him and he said, you know, he said, I just got offered a job last week on Wall Street in New York, and they're going to pay me $40,000. And you're going to pay me $12,000 to come here and work 12, 15 hours a day, and I'm going to have to share an office with, you know, 4 other people. And Ralph Nader turned to him and he said, look, he said, if you come to work for me, he said, within 3 years, I'll guarantee that you will argue a case before the U.S. Supreme Court that will change the lives of hundreds of thousands, if not millions of people in this country around consumer law. And I will guarantee you that if you go to work for that New York law firm, in the next 10 years, you're not even going to see the inside of the New York State Supreme Court. So you either come to work for me, and I will give you the chance to change public policy and consumer law in the country, or you can go to work on Wall Street and never see the inside of the state Supreme Court in New York. So 2 weeks later, Ralph and I were at the office at night, and I said to him, I said, what happened? I said, did so-and-so come to work for you from Harvard? And he said, oh yeah, he decided to come to work for me. And that situation and that story always stuck with me, and I always like to tell that story because I think the reason that all of you are here is because you want the opportunity to argue a case before the Supreme Court because you believe that making that difference and having that opportunity to affect the lives of 10 people, 100 people, 100,000 people, you don't get that if you're not in public service, if you're not in the public arena, you don't have that opportunity. And that's why I've always found it very interesting, not only being in the legislature, but to be the mayor of Portland. I get the opportunity every day, every week, to influence where the city goes and how people are affected in the city. And that's just a huge opportunity to be able to do that. So thank you very much.
Okay, so in a moment, we're going to ask our panelists to weigh in on something that Mayor Brennan touched on, and that's building relationships. But in the next few minutes, we're going to ask you to do something kind of foolish. We decided, you know, this is pretty serious stuff, so if my colleagues could help me pass these out. Each of you is going to be getting a piece of paper. On the front, in big print, is a law. It's an existing law. It exists on the books, and I'd like you to take a minute to discuss how important that law is or how you think it should be changed just amongst yourselves at your tables or within your groups on the side. Each table, each little pocket has a different law. And just to give you an example, the law that I'm holding in my hand says in Oklahoma, a citizen can get arrested for making ugly faces at a dog. Well, I don't know about you, but here in Maine, my dog does some pretty bizarre stuff, so I'm often thinking, you know, what are you doing? And I'm making silly faces, and they may be determined as ugly. But you each table has another different law, and I want you to take a minute to contemplate those. Okay, so you've had a moment to consider your perhaps outdated laws. I'm never quite sure how these laws came to be. But if we could just kind of go around quickly and someone in the group can read out loud what the law actually is that you're debating here.
Our law says in Ohio it is illegal to fish for whales on Sunday.
Okay, I don't know about you, but the last time I was in Ohio, there were no whales anywhere nearby.
In New York, when a person jumps off a building, it is against the law and they are sentenced to death.
In Salt Lake County, Utah, it is illegal to carry a violin in a paper bag.
In Maine, you can be arrested if you haven't taken down your Christmas decorations by January 14th.
Okay, now I find that really funny because there are tons of people that leave them up year-round, but maybe there's specific decorations, I don't know. Someone at this table?
In Louisiana, it is illegal to rob a bank and then shoot the bank teller with a water pistol.
Are we detecting a theme here?
In California, it is illegal for a car without a driver to be going over 60 miles per hour.
Either California has really advanced automobiles or they know something we don't.
In Saratoga, Florida, no citizen can sing and wear a swimsuit at the same time.
In Nebraska, it is illegal for bar owners to sell beer unless they are simultaneously brewing a kettle of soup.
Now, I'm thinking that one might go back to the Old West days. I'm not really sure. But the theme here is that obviously these laws are silly, foolish. They probably made you chuckle. And if at one point in time they really did have some usefulness, they've definitely outlived their usefulness. So that leads us to how do you begin to propose that you change the law? And laws like this are, pretty evident why we should probably change them. But that's not always the case. And that leads me back to the comment that Mayor Brennan made a few minutes ago about forging relationships, and in particular, interdisciplinary relationships. I think all of us could agree that within our related professions, whether it's dental or social work or pharmacology or whatever, we all have common views of things. But what happens when you bring those all together? Because those might not be all aligned with one another, and how do you get to a place of consensus? So again, I'd like to ask each of our colleagues here to weigh in on how to best do that. So a couple of minutes for each, please. You can go in whatever order you want.
Okay, well, I can start. So, this is really critically important, and I think of past policy work that I've done. What was most important was those relationships and people we brought together, and the broader the coalition, the more effective it is. And my view, anyways, go in front of the legislature, and Mayor Brennan can agree or disagree with this, is that the broader the number of people and the more people you show the impact to the legislators, the more likely they were to be influenced by that. But there's a couple of things about those kinds of partnerships. One is that you bring a bunch of people together who have sort of different views and different organizational mandates and different kinds of things. And actually, we're working on this, and this is an example right now. Literally, this morning we had a few emails flying back and forth about what people's bottom line is on a law. So if this piece gets in, even though 99% of the bill we're all in agreement on, but if this piece gets in, who's in and who's out. And you have to decide that when you think about policy and you bring people together. You have to know where they are and where their bottom line is. The second thing about relationships, I'd say, is that we in public health really rely very, very heavily on the lobbyists, is that you have to have somebody who's in Augusta, in the State House, who knows all the players constantly. And so those of us who lobbying isn't our day-to-day job, but supporting policy is what we do, we rely very heavily on those folks who both know who the players are and who can help shepherd things through and make sure that information goes back and forth and is shared with all the coalition members. So those relationships are really important. And lobbyists, even though sometimes they have sort of not a very good name, they are incredibly valuable. And what I've learned from them is that there's not such a thing as perfect policy, is that there are always compromises, and you have to go for the best that you can do at that moment in time, because there's lots of things that go into making policy.
I think talking about relationships, that's really critical to do policy at any level. I like to think I have a decent relationship with the mayor, for example. So that if we have something we're doing that we need to talk with him about, the door is pretty open. But I think one of the challenges about coalitions and broad coalitions is maintaining your focus too. I'm just thinking about legislation that I've been involved with. We're involved with legislation right now that may or may not happen, and there are so many factors. Anything that costs money, there's a whole other level of scrutiny that's going to happen at a time when money is scarce. But we're involved with trying to find an alternative funding source for shelters, and what's important about coalitions is being strategic as well. In this case, it was really important to bring in shelters from across the state, even if a lot of the work was going to be done by shelters down here, because that's the way you can get something heard at the legislature. And it also means that pulling in local shelters means asking them to try to talk to local legislators who may or may not understand what shelters do. You have to really try to figure out ways to be broad in terms of bringing partners in, but it's not always broad in terms of different professions, although sometimes it is. It can be broad in terms of being geographically thoughtful about making sure that, for example, some issues are always going to be seen as southern Maine versus northern Maine, or Portland issues. Have to be strategic about those things. We passed one of the first runaway and homeless youth acts in the country, actually, a state one. I think Mike was in the legislature then. But we had to really work with people all over the state to make sure that it wasn't seen as helping one or some small part of the state. Increasingly, I think it's important to note that when we are looking at big policy issues in the legislature, an example being the current issue around what to do about folks who are from other countries, particularly asylees, that those are issues that cut across all of our professions. Whatever the decision is, these are folks that in large numbers have health issues, will need health care, will need housing, are a burden sometimes in the legal system that is burden in the sense that the legal system isn't in a place that it can actually move them through quickly, so they take up lots of time, and that impacts everything else. They're a burden around employment. There's a huge effort now to try to look at ways to integrate new Mainers into better paying jobs, because that's going to impact their ability to get housing and to pay taxes. There's almost no part of life that doesn't impact, and certainly whether or not they can get any initial help when they get here or can't is going to impact families, kids, school. That's a big part of the young people who are in our education system. So there's no aspect of life in terms of looking at partnerships and who ought to be up at the legislature talking about the impact of how we deal with asylees. There's no profession that oughtn't be up there at least being thoughtful about that and having something to say, whether it's law, health, mental health, substance abuse, dental. I mean, all these things come into play, whether those things are paid for in some way, whether or not, what happens to the next generation as they grow up. So these are important things to weigh, and to make sure that you're thinking broadly about what impacts the profession and the people that you serve.
We're following an order here, right?
Something like that. So like I mentioned, this policy stuff is very new to me, so there's only so much I can speak on, but I just know from my experience with the bill that I helped get passed, it would not have passed if we didn't have those connections and those relationships. We needed a bunch of different eyes on it from all these different perspectives. Every person has their own perspective and strength, especially when you take into account their profession. There's just things that only you as that professional will know. So we worked with several people to help craft a bill that would actually get passed. So as social workers and clinicians, we crafted a bill that in our minds was perfect, but it just wasn't realistic. And so it went through several drafts to, okay, it's not gonna be exactly what we want, but at least it will be something. And that's because of the connections that we created through our program. So to give you a little bit of a background, this was for foster youth. They age out in Maine, or they used to age out in Maine at the age of 21. So they'd be almost done college, and they would lose all of their support from the state of Maine. So therefore, they would have to drop out of college without a degree in order to work to keep a roof over their heads. So we crafted a bill that it was extended until their 26th birthday, which is huge. Maine is now leading the nation in age out. Foster youth are lucky if they're 21 when they age out. Most places it's 18. So we had this program, it's called YLAT, Youth Leadership Advisory Teams, and it's all around Maine, which is also very rare in the nation. But folks would come to these groups, which are groups of foster youth, and it's kind of peer support, and they also help get help with their resume and job searching and support with school, but it's also a venue for them to have a say in policy and a say in programs instead of these adults behind closed doors making decisions on policies that affect them. They actually help create the policies because they know what it's like. They're the experts of their situation. So there were folks in legislature and who worked with the governor who came to these meetings, and because they were invited, and prior to coming to those meetings, they had no understanding of what the foster care system was like, and it was very eye-opening for them, and so they decided, I'm going to craft this bill. So that's where it started, and because of our connections to the governor and his staff, we were able to create a bill that he wouldn't veto. Yeah.
Good for you.
Thanks.
Well, one of the things, both in the city now and in the legislature, that I always found kind of interesting and difficult at the same time. How many of you do clinical work? Okay, quite a few of you. And how many of you that are doing clinical work also do policy work? Right. So there's the problem, is that you have an enormous number of people that are in policy positions making policy decisions that almost know nothing about the clinical issues that they're dealing with. So when I served I chaired the Health and Human Services Committee when I was in the state Senate in 2003, and fortunately the House chair had a doctorate in social work. So I had a master's, we had a doctorate, so we got along quite well. But we had to deal on a regular basis with clinical issues about pharmaceutical interventions, formularies, health policy, what to do with review psychiatric, all those type of things. And other than us, the other people that were on the Health and Human Services Committee had no clinical background and were asked to make all those decisions. So there's a gulf between those people that are in policy decisions, making policy decisions, and those that have clinical backgrounds and have clinical understandings on a daily basis. And I've always found it somewhat unfortunate that we haven't been able to mobilize social workers in a way to take advantage of that clinical experience, because people have a wealth of clinical background, clinical understanding, working with people, but being able to translate that into policy initiatives, also people struggle with that quite a bit. The other thing I'd say is one person can make a difference. And any of you out there just acting by yourself can make a difference, either with the local school board, with the Portland City Council, with the legislature, or with Congress. There are examples after examples after examples of one person, through their persistence and through their motivation, changes policy. Paul Volnick was a state representative from Sedgwick, Maine. And the first year that he was in the legislature, he put in a bill to have a single-payer universal health care system in the state of Maine. And he came to me and he asked me if I'd co-sponsor the bill. And I said, okay, Paul, I'll do it. And he said, thank you, because nobody else would. So he stood all by himself his first year that he was in the legislature supporting a universal single-payer healthcare system, and could only get one or two other people to even co-sponsor the bill with him. 8 years later, Governor King signed into law a bill that he put in to have universal health care within the state of Maine, and to examine a single-payer system. Now, it never came into play quite the way that Paul imagined, but because he stuck with it for 8 years, he went from being the only person advancing the idea till eventually 8 years later having the governor sign into law a bill that would move us towards a universal health care system. At the same time, working in coalitions, working with other people, having broad coalitions, having people that are unexpectedly coming together around common issues is hugely effective, and oftentimes The legislature, I'll tell you this, anytime there's a difficult issue, the legislature will avoid making a decision about it and create a task force or a committee to look at it. And it's not bad, because a year or two later, oftentimes the legislature will then act on those committee recommendations or those task force recommendations. And a lot of times in the legislature, when I could not get movement on something, I'd settle for a task force or I'd settle for a committee, because that was then the opportunity to bring people together, have a discussion, and then have recommendations that you would then bring back to the legislature. Right now, for example, in the city of Portland, we're trying to increase the minimum wage and become the first city in the state of Maine, and actually one of the first cities and the entire East Coast to increase the minimum wage in the city of Portland. I pulled together a whole group of people from a variety of different groups, including the Chamber of Commerce to the Green Party, to sit down and talk about how we could have a minimum wage in the city of Portland. And I'm hopeful by the beginning of June that we, in fact, will take action and increase the minimum wage in the city. But it's important to simultaneously understand that each one of you acting individually can make a difference, and all of you together in this room coming together and acting collectively can also make a difference. And it's really just a question of strategically and tactically kind of where you start from.
Thank you. I'd like to just add a personal story, actually, tagging on to what Mayor Brennan just said, that one person really can make a difference. And I had the experience a little over a year ago, about 15 months ago. If you had asked me if I knew anything about human trafficking, I would have said, I know nothing, and no, it doesn't exist here in Maine. Through a class assignment, and really no other reason than I was asked to follow up on this in a class assignment, I discovered that it actually is quite a problem in Maine. And I was able to go to Augusta in February of last year, and was part of a larger group of people who were testifying. What made the experience unique was that, first of all, I had really great advice from a friend who said, well, if you're going to testify, don't go first. And she knew me well, and I said, no, I want to go first and get this over and done with. And she said, no, you want to wait, because all these folks are going to go and they're going to give their information. You've got about 4 minutes to testify, but then you get to fill in the gaps. So whatever information they couldn't spit out in their 4 minutes, you get your 4 minutes to fill in the gaps. And if you wait until near the end, you will see legislators all kind of nodding their head, going, oh, okay, I get the bigger picture. It was a really powerful experience. What I didn't know that day was that, one, it was going to be recorded for NPR, so was very surprised when, in the weeks to come, several people came up to me and said, oh, I heard you on NPR. I was like, what? I had no idea. But more importantly, when the bill finally passed, and it did, my name was actually attached to it. Now, I don't want to toot my own horn, but to be able to say that I had a role in that was incredibly powerful and made me, much like Jenna's experience, say, oh, I can do this, and I do have a role, and I have a responsibility to look at things that need to be addressed and make my voice and perhaps represent the voices of other people be heard. So it was one of the guiding things for me in being involved in this event today. The next piece I want to talk about briefly before we move on to another activity is talking about and addressing kind of all of the different health professions, perhaps, the importance of that interdisciplinary work in your practice, how it impacts policy and vice versa. And I think you've all touched on it a little bit, but in terms of, you've touched on the coalition building, how do you even begin to get started? You see a need, and I'm sure you can all think of one. How do you then reach out and find a way to make it be of importance to all of these other health professions?
I think the first thing has been said, which is relationships, is that you start with relationships that look for common ground, and there's always common ground between our professions. Anybody in the health world or helping professions is going to have some common ground because we've made some kind of choice about what we're doing with our lives in terms of values. You're reminding me, I made some notes. I mean, there are a lot of ways to to bring people together around a shared problem, obviously. And you talk about something like trafficking, and when we put together a coalition that really focused on that, it's because everyone could see a piece of it, and everyone had something to contribute, whether it's from the law, from health, from mental health, substance abuse. It became pretty obvious. Another big piece that I guess, and I'm kind of a hybrid of some sort. I do love to do direct services, but I do have a doctorate, and I kind of like research and data sometimes, especially if I get help with it. And I think that's another really big, important piece of, is really, it does help to not just to combine the feelings and the understanding with sometimes data. And I'll just give an example that, I was talking about the aging of people in shelters. How can you get someone from a big institution like Maine Med to the table? Talk to them about the cost, and talk to the state about the cost of a few people who are going to the ER every day because they don't have an adequate place to get health care. And it doesn't take much to get them interested in looking at, the fact that the highest users of some of the resources there are people living in shelters who, if they were housed, we could save a lot of money. That gets a lot of people interested. So having some data sometimes can really help in kind of pointing out the ways that we all interface, the ways that what we do and what they do really can work together to do better care for people, but also in this environment, a lot of it, and somebody else mentions cost savings. I mean, for better or worse, if you can show that what you're doing over time is going to save some money, you can bring lots of people to the table, whether it's on their part in an organization or a profession or the state. So I think that's another strategy, certainly, that we've been able to get lots of people to the table by pointing out their piece of what we do and how we can really help them do things better and sometimes more efficiently.
I totally agree with everything that John just said. A couple of things that really important to find when you're looking at an issue. Make sure you really examine it from all sides to see who else may be interested and what their piece is. Even if it's not your piece, it may be somebody else's piece, to bring them together. So I totally agree with that. And just, I don't have too much to add to that, but just to say one practical thing is think about your professional organizations. Maine Public Health Association, and I'm sure all of you have your own professional organizations. There's probably a student membership piece of it. Almost all of those organizations are involved in policy and advocacy in some level. And that's a really nice way to get involved really early on because you can see how things work and get connected, and they're always looking for students to testify on issues. And usually, like I know the Public Health Association, I don't know, they're always watching like 40 bills or something. There's always a way to get involved. So that might be a really good way to begin working on policy.
Go ahead.
Not sure if this totally connects, but just what comes up for me. When I was getting ready to graduate, I was going to the IPEC events, and then that in combination with the campaign school, I was convinced that when I graduated, I wanted to create a program that kind of combined the two. And then the more I researched and networked, I realized that there were already organizations out there that I could just replicate and work with. So instead of reinventing the wheel, I brought those programs here. Besides the campaign school, the other one is called New Leaders Council, and I created the Maine chapter, which it's a 6-month intensive training program for young professionals who are leaders. And so it's a group of interprofessionals that come together as their own little cohort, but it's also a part of a larger network across the nation. So I guess my point is that where we're at in history and the issues that we're facing, I think it's time for really innovative solutions. And I think programs like New Leaders Council, the campaign school, the IPEC things that we do, it's just the start of really creative solutions for really creative issues that we need to tackle.
I think I'd say if you left here today, I always throw these things out, but just what you said about speaking later, if you're an elected official, you always speak first because that's when the news media is there. They all leave by the time they get to the fourth or fifth person. But you know, there's some research that shows that people start losing attention in what you have to say in about 29 seconds. So I always tell people I have 29 seconds to tell you what's the most important thing for you to remember, and then if you forget the rest of it, you know, so it goes. But this idea of interdisciplinary work, if there's nothing else that you leave here today thinking about, that's the thing to think about. Because the future of the world is all about interdisciplinary work. And I was fortunate after I graduated from UNE, and I worked in a private clinical practice that did systems theory. And we didn't do Freudian inner psychic dynamics. We talked about systems theories, and we always talked about people in the context of their family system and their social system. And we weren't as focused on what we were trying to do with the individual person's psychological profile. We're always looking at ways to help people adapt within the systems that they worked in. But I also spent 2 years working at the Maine Youth Center with some of the most difficult, troubled youth in the state of Maine. There was never a youth that came in that had a substance abuse problem, that didn't have a mental health problem, that wasn't in the child welfare system, that didn't struggle in school, had an IEP for education, and had been traumatized by the family background that they had been in. If you didn't think in terms of interdisciplinary, you didn't think in terms of systems, you didn't do anything with those youth. And what used to be really interesting to me, and I was still kind of young and didn't know a whole lot about what I'm doing. Now I'm just older and don't know a whole lot about what I'm doing. But it was always amazing how, as a social worker with a substance use background, we would sit down and look at the world for that youth size in the prism of substance abuse, when there are all these other things that are going on in their life, but our training and our background and our theoretical perspective was focused on substance abuse, so that's what we spent time focusing on. And you just inevitably found out that if you did that, if you stayed in that structure, you stayed in that theoretical perspective, you stayed in that paradigm, your effectiveness was significantly less. And once you could jump outside and start thinking in systems and systems theory and looking at the youth in terms of their family system, their social system, their community system, and everything, and even their system at the Maine Youth Center, then you could start to help them navigate and make decisions and do things that would make a difference in their life. So I think it's great to have social workers sitting with healthcare professionals, with nursing. One of the hallmarks of UNE has been the fact that it's had a medical school, and that has built a niche, a market, a curriculum, an educational institution around medical professions, but they've always looked at it in terms of being interdisciplinary. And that's why there's a pharmacy school, there's a dental school, there's nurse practitioner, there's all those different things. And that's just fertile ground and rich opportunities to be able to learn different perspectives and different interventions that make a difference. Because and John will tell you the same thing, there is almost nobody now that is a single issue, single problem person. We don't live in that kind of society anymore.
So at this point, I'd like you to take your silly laws from earlier in our program and flip it over to the back. You all have the same information on the back. These aren't different laws. But we were looking for something that was health-related that either was in the process of being changed or maybe needed to be changed, and wanted to have everybody take a moment as a representative of their profession and weigh in on maybe what they could do to help this law get changed. And this is dating back to December 23rd, 2014, when the Food and Drug Administration announced that it would scrap a decades-old prohibition on blood donation by gay and bisexual men, a major stride toward ending what many had seen as a national policy of discrimination. The issue at hand was, or still is, that the agency will continue to ban men who have had sex with a man in the last year, saying the barriers necessary to keep the blood supply safe, a move that frustrates rights groups that were pushing for the ban to be removed entirely. So take a few minutes at your tables or in your groups, and from your personal and professional perspectives, have that conversation. What would it take? What kinds of things could we do to perhaps push that to the next level?
Hi. I'm mostly interested to know, kind of who is making the decisions within the FDA and how they're influenced by different lobbyists and different people who have kind of a vested interest in the matter itself. But also just there aren't really a lot of facts regarding medical or scientific advances in the field and kind of how that plays in. And it really talks about a lot of things, including sex and medical testing, that is really uncomfortable for people to talk about. So really trying to open up those conversations and really getting information from all the people that have a vested interest, I think, would be really important.
Just going off of that, I think the basic thing and kind of what Mayor Brennan had said earlier about people making policies without having the clinical insight to do so, and just like basic education that we are not where we were with the science with HIV that we were in 1983, and that we do have quick tests. So really we have the information to back it up, and how do we get that information out there in education and through building those relationships and advocating.
Thank you. Anybody else? And are there any further questions for our panelists today? You're all so quiet. At this point, I would like to turn it over to Jenna, who's going to give us a little more of a description about the campaign school that's being offered at the end of the month. If you have an interest in policy, tune in. This is an amazing opportunity to come here to UNE. The fact that UConn has done this for 20 years, but nobody else in the country is doing it, I think, again, makes for an opportunity for UNE to really put themselves on the map.
Thank you, Linda. So just giving you a little bit more of a background on the campaign school, it is hosted through the School of Social Work, but it's also open and encouraged for other professions to attend. Just off of the conversations that we've had today, is us as social workers aren't going to create the solutions in a silo, and it's going to take all of the professions to come together with their perspectives. And you as clinicians, if you're not seeing issues already, I'm sure you will soon. And it's those experiences and that expertise that is needed to be testified about up in the legislature or run for legislature and lead a bunch of bills. So I'm going to be sending an email out to all students with more detailed information, but I do have some flyers. Anyone who's interested in registering, it's free for UNE students, and spread the word. Scholarships available to non-UNE students. Are there any questions or anything about the campaign school, or any questions for the panelists? Yes, emails are coming out with more detailed information.
So as we begin to wrap up, oh, I'm sorry, Mike, go ahead.
Is there a limit to the number of people that are going to be accepted into the class?
This building can hold, I think, 200 people, so.
Do you have a date picked out for this yet?
April 24th and 25th, which is a Friday and Saturday. And there's some really incredible people coming, so if nothing else, it's a great opportunity to network and meet some really powerful people that are doing some really amazing things in Maine.
If you're finishing up an internship, can you count some of those hours as field hours if you're missing out from your internship to go?
As far as social work students go, yes. You can get hours for field. You just have to get that worked out with your field person, but it shouldn't be an issue.
Thank you, panelists, for a fantastic presentation. But I was wondering, what do you folks, from your different perspectives, need from any of us here to work on the wide range of issues that are facing you all now in this legislative session? How should people in this room coalesce, be helpful, support those efforts, especially around general assistance, homelessness issues? I know a lot of students here are interested in those issues and want to see it, are following it and seeing it play itself out in the legislature. Is there anything that people can do by contacting any of you that would be helpful?
Come to the campaign school. There are a bunch of different listservs that you can join that you'll get emails and they'll tell you what bills are up and how to follow them. There's some really amazing organizations in Maine that are all have their own bills that they're following and testifying for, so it's great to get connected with those organizations.
Well, you know, Frank, I think that's a good point. And I used to be always surprised, again, when I chaired Health and Human Services Committee, when I served on it, we almost never saw people from social work schools. We almost never saw faculty members from the university system, whether it's social work or tax policy or education policy or anything else. And you know, and I don't say this cynically or jaded by this, but often, very often, too often, in public policy, in the legislature, the Portland City Council, whatever, anecdote trumps research. And people's personal experience, that anecdotal situation about how they've seen somebody with a food stamp standing in a line, that will trump years of research on welfare fraud. And it's incredibly important to have people from UNE, both students and professors, stand up and say, here's what the research shows, here's what the evidence shows, here's what's best practice, and try to be the objective, rational voice in a process that oftentimes is driven by emotion and people's own subjective understandings of things or their personal experiences that are very limited. So I would just encourage anybody, if there's a particular issue, there is the National Association of Social Workers, the Maine chapter. There are all kinds of other healthcare, nursing professional organizations for people to work through. But the legislative process is remarkably accessible to members of the public. And anybody that wants to can get up at a public hearing and speak about whatever they want to for almost as long as they want to. And that's quite remarkable. And Maine is one of the few states, if not the only states in the country, that have public hearing on every bill that is introduced within the legislature. And it is the practice that every bill that comes before the legislature, and sometimes that's 2,200, 2,500 bills, there is a public hearing and an opportunity for the public to come and speak about those issues. So the opportunity to speak with legislators, influence legislators, speak with public officials, influence, and participate in that process is remarkably available to people in the state of Maine.
I'd add a couple of specifics. One is that certainly people can connect with us around the public policy issues that we're involved in that have to do with poverty. Although I think one of the best, one of the things that we do a lot, we have very close partnerships. We partner with Maine Equal Justice Partners a lot. They're the policy folks and who really are often following the legislation. What they often need are people to come and testify who can bring the real experience, and that's where we come in and why we partner with them. We can organize a lot of folks from our staff even who can talk about the asylum experience that they had before they were allowed to work, and we can bring consumers up. When I say that, it's also something that you can do, and so paying attention to what's out there and not just thinking about what you can say, which again, I think what Mike said was absolutely true about schools and faculty and people coming up, it makes a difference here. We're a small state and we get to talk with everybody. I come from New York where the idea that you just go up and talk, it wasn't that way. There were layers and layers. But you also there often are issues that they're looking for people who fit a certain category, whether it's people from a certain population. An example might be, when they changed the SNAPS benefits, it was really important to find people who were involved with getting food stamps who were going to lose them, or people when we didn't go forward with main care, and that meant a lot of people were going to lose main care who were there because of their income in the past, and all of those people lost their main care. It was important to have those folks show up and talk about their experience, to have veterans show up and talk about the impact on a veteran who depended on additional health care needs. So you have the capacity both to go yourself and also to be part of identifying folks who are impacted if you're working with people who are impacted. And I'd always recommend the Maine Equal Justice Partners, MEJEP site is a good one if you're tracking those kind of policies around poverty issues. They often will have a clear sense of what's going on in terms of hearings and things, and that's a good way to get that, I'd say. But again, you can also get that from us if you ask. I would send something to Preble Street asking for the advocacy folks, and or Homeless Voices for Justice, which is the consumer advocacy piece, and they're involved with tracking legislation on these issues all the time.
And just to put a finer point on this, it's not just the legislature. I convened a substance abuse task force. 75% of all the crime in the city of Portland, police chief says, is related to substance abuse. And we're working on putting into place a model program from Seattle here in the city of Portland to address substance abuse. We had a healthcare policy committee. We led the country in the number of people that signed up for the Affordable Health Care Act because we had an outreach program to all kinds of different people within the community in Portland, because we said everybody that signed up for health care, that's good for the city of Portland, and it makes people in the city more healthy. I have a mayor's task force on healthy and sustainable food, and we're looking at ways, we want 50% of all the food in the Portland school system to be locally grown next year. And we're expanding community gardens, and we're working on a number of different issues to make Portland more sustainable. 85% of all the food in the state of Maine is imported from some other state or some other part of the country. And so we're looking at how we can become more sustainable locally, how we can support local businesses, and how we can cut down on the carbon footprint by not having so much food have to be transported into the state of Maine. We have sea level rise initiative that we're focused on, and we have probably the largest and most expansive public health program within the state, just because we're the largest city. So there are all kinds of opportunities at the local level, not only to be involved in policy work, but to be involved in initiatives that we think are going to change the face of Portland.
And I just add that just before she loses her question, she has a question.
Actually, I just wanted to say it's funny that you guys are presenting this now, because next week the PAs are actually testifying, and we're having a bill on April 7th. So if anyone wants to go and see how the process works, or if any PA students want to be involved with that, not really social justice, but it deals with our licensure. So yeah.
Can I just add that there's every single person in this room could do something today. You could send an email. You can go online and find out on the website, find out who your legislator is. You could send them an email today on any issue. You could write a letter to the editor on any issue today, and those are all things that every single person in this room can do. I can't think of a time where I've been more afraid as a public health professional about what's happening in this state, and so I really encourage you all to get involved. I'm very worried about the public health system that we will have left in the next few years, so I encourage you, all of you, to get involved.
And what Karen just said is actually a great segue into our closing activity today, which I'm going to have Bridget speak on in just a moment. But I wanted to share briefly that when I got to go to Augusta twice actually last year at this time, and one of those times was to meet with a local legislator, and one of the things she shared with our group was that the question was posed. So how many constituent voices do you need to hear before you sit up and say, oh, I probably should pay a little more attention to that issue? She says, when we get like 4 or 5. And I was dumbfounded. I said, that's all it takes is 4 or 5 notes or emails or letters or phone calls? And she said, yeah, that's usually a sign that it's an issue that is a hot button topic. 4 or 5. So on that note, Bridget?
So on everyone's table, there's some postcards, and this is a way that you guys can get involved today, right now. There's postcards, there's lists of different representatives and senators in the state legislation. There's an idea of some issues that I wrote down. If you heard some issues up there that you want to write about, if you have some in your head, the address goes on the right side and the little note goes on the left side. And if you don't have enough, there's some more up here of postcards.
And we will take care of stamping them for you, so you don't even have to worry about that. And it can be as simple as, I really want you to consider voting this way for an issue, or I want to weigh in and let you know that I'm in support of or against whatever the issue happens to be. Decision is yours, but we wanted to give everybody the opportunity to actually make a difference today. So while you're doing that, I'd like to thank our panelists again for giving us their time.